One of the most difficult things about cow's milk allergy is so many of the symptoms are absolutely bog standard, typical infant symptoms that all children will get at some point. So I think it's important to get the context right. There's no suggestion at all that every time there's a little bit of eczema or a few days of loose poos that we need to be thinking about cow's milk allergy.
So if it's persistent?
But it's really much more about that persistence, absolutely.
Right.
So things like eczema that's really troublesome, that doesn't respond to the creams that the doctor would quite appropriately give you, and if anything's getting worse, particularly if you're moving from being breastfed to bottle fed, so suddenly there's much more cow's milk in that child's diet,
so you
and you see the symptoms getting worse.
These things, but it doesn't necessarily mean that there's
most eczema has got nothing to do with milk allergy. Most reflux, most colic, most diarrhea has got nothing to do with food allergy at all, but a really important minority it is. And those ones, they'll be the more severe ones, they'll be the ones where the symptoms keep going on, and they'll be the ones that resist treatment. And it's those sorts of signals that ideally both parents and doctors will be picking up on and saying, wait a minute, maybe we need to think about something else here, rather than just giving you more steroids for the eczema or more medicine for the reflux.
If in doubt, go and get things checked out, I would.
Of course, if the child's still got milk in their diet and they've got better, then it's very unlikely to be a milk allergy because they've got better. But it's when those symptoms keep going and keep going, especially if there's lots of them and in different systems. So a child with eczema who's also got tummy problems, that's a little red flag for a doctor to think, well, maybe there's something else going on here.
So I was going to say, Jenny, from a parent's perspective, if you're at home with your child, what sort of symptoms should we be sort of worrying about that we might see and go, actually, maybe I do need to go to the doctors now?
Well, there's a lot of general symptoms, as we've been discussing, things that you might actually notice in your child or present in your child that you aren't concerned about really on their own. If they've got diarrhea, if they've got a bit of nappy rash sometimes, if they've got a rash on their face. These could be linked to teething, they could be linked to a cold, the wheezing, lots of little things, but when they're combined together, it can be quite serious. I mean, some people can confuse elements of colic with the stomach ache. I'm looking at you all the time just because I don't want to say the wrong thing, just in case I panic people unnecessarily. But there are so many symptoms that it's actually quite a good idea to go to cowsmilkallergy.co.uk to get a proper list, and they show the differences as well and when you should be alarmed.
This is from Lisa from Epsom, and she says, is there a link between milk allergy and reflux?
That's an excellent question.
Do you know the answer?
There is, yes. Reflux is really, really, really common, and anything up to 50% of infants reflux at some point. And for a lot of them, it's normal, it's fine. It's a little bit of floppiness of the little valve between your stomach and your feeding tube, and it's not a big deal. But for a small number of kids, it is a big deal, and they have what we call gastroesophageal reflux disease, i.e. it's a problem. So they're bringing up so much so often that they're not able to get enough to nourish themselves, or is getting into their airway and causing breathing problems, or there's a whole range of things that can potentially cause. Now, there's quite a lot of debate over what proportion of reflux or significant reflux is due to milk allergy. Some experts suggest it's up to even 40%. It probably isn't. It's a significant number though. And reflux is one of those symptoms that if it's a problem, you need to be discussing with your doctor. Is it possible that there's underlying milk allergy here? Because sometimes switching formula can really turn it off.
Right, so the key really is go and see your doctor.
Yeah, and it's one of these things that if it's a problem, if it's not responding to the first line treatments, if there are other symptoms, that things like eczema, so other things going on, all of those should make you think a bit more about, is it possibly a milk allergy?